Good morning. Good morning. Ooh, I like it. Welcome to Influencing an Inclusive Climate Health IT Edition. Just one ground rule. For any questions, please hold on to them to the end, and I will walk around with the microphone. All right, thank you. Please welcome your speakers.
Hi, everyone. Thanks for being here today. My name is Carrie Mullen. I'll be kind of kicking us off to start. Thanks for joining us. Yes, we'll be here talking about Influencing an Inclusive Climate Health IT Edition. I'll start out by letting my fellow presenters introduce themselves.
Good morning, everyone. My name is Christina Houston. I am currently the ARC co-chair of our Health Anti-Racism Committee. My day job is I am currently the Radiant Principal Trainer for our APEC system. And just a little quick thing about me and why I'm very passionate about our role. I have been a Bay Area native, and I'm also African-American and Guamanian. So I have a lot of different mixtures in me. And so it's really nice to be a part of an organization that really puts DEI and inclusiveness at the front line. So I'm going to go ahead and hand it off to someone.
Hi, good morning. I'm Sanette Weiss. I'm Director of Analytics Strategy at UCSF Health. And I'm also the subcommittee chair for the Health Equity Research Subcommittee. You'll hear more about that in a bit. And I think, one of the reasons to add to what Christina mentioned, I'm very passionate about this work, being an Arab American woman, and I was born and raised in Chicago and witnessed so many situations and experiences of racism to others. And so I definitely developed a passion for this work, and I'm very grateful to work for an organization that prioritizes this as well. So.
And again, my name is Carrie Mullen. I'm Christina's fellow co-chair for this year's UCSF Health IT Anti-Racism Committee. And in my job, I'm the Radiant team lead on our EPIC team. I'm also very passionate about anti-racism and DEI in general. As a queer trans man, I have also experienced oppression, and I think that a very important part of allyship is showing up for others who have experienced oppression, even if it's different from what you've experienced. So I'm also very grateful to be part of an organization that values this work and gives us time to dedicate to it. So go ahead, and I want to kind of give you a preview of our learning objectives for the session. We'll be talking about some approaches for facilitating a culture of inclusion in a primarily virtual or remote work environment. We'll also talk about some strategies for planning and uniting anti-racism work within your health IT department. And then we'll talk a bit about improving digital health equity for all. So our quick agenda, we'll do a little bit of background on our anti-racism committee and kind of what we're about and how we got started. Then we'll go through our 3 learning objectives and then talk about some measurements of success at the end. Before we really jump in, just a quick glossary of terms that you might hear us use throughout the presentation. If you hear us referring to APEX, that stands for Advancing Patient Care Through Excellence. And that's just UCSF's branding of our electronic medical record, which is EPIC. Which many of you may be familiar with as well. If you hear us referring to ARC, that stands for Anti-Racism Committee, just shortens up the mouthful a little bit, so we'll be using that quite a bit. And then you're likely already familiar with DEI, which stands for Diversity, Equity, and Inclusion, and DEI-AR, which is Diversity, Equity, Inclusion, and Anti-Racism. So with that, I will hand it over to Christina.
All right, to just give us a little bit of background and context, our Health IT ARC charter was established in July 2020 as the Clinical Systems Health Informatics Anti-Racism Committee. Just this past year, we have recently expanded to include other health IT teams, including CS, HI, Health IT, and our Center for Health Innovation, which is CDHI. The UCSF Anti-Racism Committee is focused on dismantling all forms of racism, including but not limited to direct and indirect racial discrimination, racial harassment, victimization, racial discrimination by association, institutionalized racism, and systemic racism. Our ARC goals. So one of our goals is to influence our UCSF mandated yearly training policies to include areas of unconscious bias training and other anti-racism awareness trainings. Create processes for our anti-racism self-advocacy within clinical systems and health informatics, and also to influence UCSF's hiring and promoting practices to be more transparent and improve hires and promotions for BIPOC persons in IT and transform culture. Influence UCSF's policies in areas of transparent evaluations to minimize and eliminate double standards for BIPOC persons to increase equality in IT promotions, and to collaborate opportunities of support with other DEI communities throughout UCSF in solidarity, and also to create and coordinate opportunities in the community with other anti-Black awareness, BIPOC, and anti-racism efforts. So we'll talk a little bit about our structure and our roles. Our co-chairs, we have 2 co-chairs here. We oversee our ARC activities and create and facilitate our yearly ARC roadmap. We expanded into subcommittees. So we have an admin committee, subcommittee. They coordinate ARC administrative functions and take notes. They send out agendas and take notes for our biweekly meetings. We also have a web admin subcommittee team. They build and maintain our ARC website. Our learning team subcommittee provides DEI educational opportunities for our health IT division. And our speaker series subcommittee recruits and plans focused speaker events monthly. And our Heart to Heart is a monthly anti-racism brave space discussion groups. So they plan accordingly and create monthly discussion focus groups. In our Health Equity Research Committee, they research DEI-based Apex build impacts within our system. In our Outreach Subcommittee, they initiate collaboration and expand ARC's footprint. This is a new role that is coming in our new FY23 charter. All right, and I'll hand it off to Carrie. Thank you.
Thanks. So now I'll talk a little bit about some approaches that we've used to facilitate a culture of inclusion, particularly in a remote work environment. So first off, I'll talk about our Heart to Hearts, which Christina just mentioned. These are monthly gatherings focused on open, brave conversation spaces with colleagues around a variety of DEI AR topics. Obviously, these are conducted virtually over Zoom. Each month, we specify a topic for the month and let folks know ahead of time what that topic will be. Some past topics that we've done recently include things like critical race theory, intersectionality, and LGBTQ visibility, health disparities impacting women of color, and blanking on the last one I was going to mention, but we do one a month for the past couple of years. I'm actually going to jump down then to the bottom and talk about our communication guidelines. So these are guidelines that we share at the beginning of every heart-to-heart discussion to kind of help cultivate a brave space for dialogue. You might have heard the phrase safe space in the past, and we are leaning towards the newer ideology of brave space, which encourages people to be open to hearing new perspectives, having their views and opinions challenged, and leaning into the discomfort rather than running and hiding from it. We've also got our speaker series. So we aim to put on quarterly speaker series events where we bring in speakers both from within UCSF and the greater community to talk about, a variety again of diversity topics. And we've begun following these speaker sessions up with informal town hall discussions as well, sort of modeled after our heart-to-heart discussions to kind of give a space for folks to discuss and reflect on the information that was shared from the speakers. Then we've also got our cultural calendar, which is sort of an inclusive collection of a wide diversity of things like religious observances, different holidays, heritage months, both meant to be a central place where everyone in our division can come to learn about different cultures and celebrations that they might not be familiar with, and a place for folks in our division to see their own cultures and celebrations reflected. We've also got our learning library available on our ARC website. Obviously, it is a virtual library, but kind of a curated list of different resources available for folks to go to and use to expand their knowledge on a wide variety of topics. We've got all kinds of different formats, podcasts, videos, books, TV show recommendations, and kind of the goal of that is to provide an additional way for folks to sort of self-educate. There might be people who aren't able to attend heart-to-heart sessions or speaker series events, or just perhaps they learn better kind of on that self-directed environment. So just providing another set of resources for folks to educate themselves. Obviously, in a remote work environment, we have to acknowledge the use of Zoom. We always encourage participants to come to discussion sessions with camera on, help engage with each other face to face since we can't actually be in person, but we do not require it. We want everyone to be able to participate at whatever level feels comfortable for them, acknowledging that everyone is at a different point in their journey and also just different comfort levels with communication and having videos on. So we welcome everyone to participate at whatever level feels comfortable for them, but we do lead by example and have, as facilitators, we always make sure to present with cameras on. We also like to set an expectation of confidentiality when we're in some of these discussions, acknowledging that they can be sensitive or uncomfortable or get personal. And we want folks to feel as comfortable as they can sharing as much as they're able to. So we sort of set that expectation at the beginning that what's said here stays here, but what's learned here leaves here. So if you learn new information or a new perspective, take that with you, but leave the personal details behind so that folks can feel comfortable to share and know that that will stay within the room or the Zoom, as it were. We also do not record those Zoom discussions. Focus groups. So we've used focus groups a few different times to gain insight into the perspectives and experiences of folks in our division. When we were first getting started as an overall committee, we held several focus groups to find out, what people's experiences were, what their concerns were, so we could kind of guide our ARC roadmap to, address those work efforts where we felt the attention was needed. Soliciting input. We use Qualtrics quite a bit to gather feedback from folks in the division and event attendees to find out what topics people are interested in hearing about, what we've done well, what we can do better, new areas that we should expand into, make sure that we're staying in touch with folks throughout the year and, giving the people what they want and what they need. And lastly, our conversation club, sort of the newest addition to our lineup. It's meant to, again, be another alternative way for folks to engage in discussion and dialogue. It takes place on Microsoft Teams. We open a channel for 1 week out of the month. Ahead of time, there'll be a piece of content designated, either a short video or an article for folks to read or watch, engage with, and then, on their own time, then can jump into the Teams chat and discuss it. So again, just kind of providing another format for people to engage in dialogue outside of our other offerings. And with that, I will hand it back to Christina.
Thank you. Thank you, Carrie. So I'm going to talk us through the strategic planning and uniting of our anti-racism work within our department. So how did we do it? First thing is we have an executive sponsorship. We have an executive sponsor. So it's really important that we have a meeting cadence regularly with our executive sponsor for support and guidance. And during that time, we also talk through any different challenges that our committee might be facing. We also have an all hands presence, so a standing time for ARC updates and any type of events that need to be communicated within our all hands presentations. We also have learning topics monthly that are provided at these health IT all hands agenda meetings as well. We have a structured meeting cadence. So our anti-racism committee meets bi-weekly. And we meet every Thursday. We have recurring subcommittee meetings. So quarterly, we meet with our subcommittee co-chairs as well. And then we have monthly status reports that are submitted to the ARC chairs. We also have leadership involvement. So leadership buy-in is very big. And we have participation in ARC meetings at the manager and director levels. So it's really important that as we do this work, we have executive leadership buy-in across the board. Another way that we strategically planned is we designated time for DEI work. So we have established protected hours within our time management system for our members to log time for all of the work that they are doing or any of the events that they are attending and being a part of. All of our subcommittees, as well as the ARC committee, has SMART goals. So we outline yearly SMART goals for ARC and the subcommittee to measure yearly successes of what we are currently doing. We analyze our climate survey. So this is a yearly climate survey that goes out to all of our colleagues across the board. Here, we are able to analyze data for trends over time. We're able to identify opportunities for intervention and gauge impact for our ARC initiatives. And also we have monthly standing meetings, and it's really important we collaborate with our Office of Diversity and outreach. So we established a relationship and a meeting cadence with our Office of Diversity and Outreach. And we also have standing meetings with other UCSF DEI groups as well. And now I will go ahead and hand it off to Sana.
Thank you, Christina. Whoops. If you attended the panel that was just prior to this, the Health and Equity and Health panel, there were some great points, and especially I wanted to point out, Dr. Briggs Melanson mentioned how there's bias in data collection and bias in data interpretation. And so, keeping that in mind, it's really critical to address bias in data in general. And then as a data being my other passion, being the subcommittee chair for the health equity research team has been extremely rewarding, as we have, done a lot of work on addressing some of these equity issues within the data and within the build of EPIC, our system. And I think some of this can also be extended. I know that not everyone here is from the health side, but if you think of any of your systems that require build and what bias could be included in that build, I think this could be extended in that way. And so our subcommittee focused on our EPIC build and DEI data and analytics. And so we've already completed a lot of successful initiatives, and some of those listed include having a tag on our ServiceNow tickets that can be placed to notify that we need to review for equity impacts. So we did develop this tag, and I'll talk a little bit more about that and what we're doing with our ServiceNow process as well. But we partner and collaborate with several teams, and we've been able to complete projects such as including race ethnicity into our COVID-19 screening protocols, racist language such as problematic ICD-10 codes were removed. And then a process has been established for patient-facing EPIC translations and ensuring inclusivity of preferred names in patient search fields. So several initiatives are currently in progress, such as an analysis of FYI flags and best practice alerts that disproportionately label patients of color as security risks. Also, there's a review of UCSF's use of collection agencies, addressing language and translator concerns, SOGI initiatives, and continued review of race ethnicity mappings to comply with regulatory and internal standards. And so there's a lot in progress. Several members from our subcommittee also partner with other and collaborate with other groups, such as our health. We do have our data equity task force, so we do have liaisons to that group, as well as other groups across the organization. And so there's definitely a lot going on. And, one thing I'm going to talk about shortly is just how we measure success of the work that we're doing and the SMART goals for the various groups. So one example of the work that this subcommittee has completed and is in partnering with some of the other teams is how we assess equity of our ServiceNow tickets. And so the subcommittee, the Health Research Equity Subcommittee, is actually comprised of resources or a designated resource from every application build team and the analytics teams as well. And we have created a tag that I mentioned earlier that can be marked to identify tickets that need to be assessed for equity. As we are now enhancing and revising our ServiceNow ticketing process, we're also helping the teams work through what are the proper equity questions that need to be asked for enhancement requests, for example, to make sure that we're assessing the equity impact of these tickets. And so along with that tag, we are assisting with how those questions should be formed and what we should be asking. And that helps drive a scoring. And there's a DEI impact score associated with those tickets. Again, I think this is not necessarily just relevant to health. I think this is also for campus as well. If you're working in ServiceNow and any new requests that come in, and the ability to be able to assess the equity impact of those requests is really critical. So I mentioned data is my other passion, and so I wouldn't I couldn't stand up here if I didn't talk about measurements of success of the work that we're doing. And so just as we would assess success on any projects with metrics, we also have SMART goals that each of the subcommittees, as well as our the overall anti-racism committee, are defined every year and that we work towards. And so a few of them are listed here. For our subcommittee, on the right-hand side, one of our SMART goals was to really increase participation. And so what we did is we just assessed the volume of attendees to our regularly scheduled meetings the prior year and measured it against this year. We only included months where there was data for both years, so we could measure appropriately. But the nice thing is we look at this and we do see that we did have increased engagement and increased participation, which it was nice to see that we did meet our SMART goal for this year. And then I know you heard a little bit about the climate survey earlier. We did pull data on the participants of the climate survey and assess just, we also have to assess the equity of those responses. And so we have a few charts that illustrate that as well. And then, I just a few other goals listed for some of the subcommittees, just making sure that we are scheduling a certain number of speaker series events each year, having meeting structures established, to increase engagement. We want to make sure that we are presenting at various forums. And so we want to make sure that we are presenting at several of the all hands meetings throughout the year. But so far, we have met a lot of our SMART goals, which is really promising. And we are right now in the process of beginning our new year. And so we're going through elections for the new subcommittee chairs. And we have defined new SMART goals for the coming year. And so we'll continue to measure these goals and hope for increased success with the work that we're doing. Just a couple of examples of some of the future goals that have been defined. We want to make sure with a lot of the change that's happening that we're aligning with the new structures and we're enhancing collaboration. One thing we learned about over the past year, there are a lot of groups that actually work on this across campus and health. And so we want to make sure that we're collaborating with these groups and continuing to promote participation, increasing membership, and just expanding the work that we're doing. And so we are nearing the end of our presentation. I think that I'm going to hand it off to Carrie to wrap it up, but thank you. I think we'll talk a little bit about the appendix. Yeah. Okay, thank you.
Yeah, thanks everyone. Going back to the last slide real quick. Unfortunately, our website is not public facing yet. So if you are a UCSF employee and can get on the UCSF network, please come check out our website. If you're not, hopefully we'll have a public facing website soon. And then yes, just to refer to the appendix in our slides. There's some more resources there for folks who are interested. We've got a link to the communication guidelines that I mentioned earlier, which we borrowed from a different organization in Los Angeles. And then we've also got some what we call business terms to avoid, which is terminology with racist or problematic origins that we have tried to socialize within our division to use better substitutes for. So an example is something like whitelisting and blacklisting, particularly in an IT space, are terms that are used, and instead we use allow and blocklist. So just wanted to let folks know that those resources are there in the appendix. And thank you all for being here today. And I think we can open up if anyone has questions. One back here. Yeah.
Hey, great presentation. I'm from UCSF, and I think UCSF generally is a pretty welcoming environment for these sorts of ideas. It's one of the reasons why I really, like working for UCSF. So I'm curious. I'm just curious what your thoughts are, sort of in an environment where this is so welcoming, working on an issue that sort of generally in the country is, and in the world is so divisive, sort of how, like, yes, you're making a excellent impact sort of within the environment that you have control over, but that's already a more welcoming environment, and sort of how you reckon, maybe not being able to influence areas where that change would be most felt. Yeah, just curious.
Thanks, Jory. I think that's a very good question. The work that we do impacts our environment at work, but it also impacts what we're doing outside of work. And so while we have a very welcoming environment at UCSF, we still have a lot of room to improve, as all organizations do. And so I think it's valuable there, but I also think that we take this home with us and we influence all of us, all of the people involved, influence other aspects of our life, like where we go back to our own communities. Like, this work it doesn't just stop here. And so the hope is that it also just influences work as well as outside of work.
I'm just curious about how you go about identifying campus partners, and like, is one person responsible for reaching out, and kind of like, how do you collaborate with them, and what does that collaboration look like, and how do you maintain it, like, in a productive way over time, in a sustained way? And then are there kind of larger goals that you can work towards together, even though they're outside of your ARC group? That was my first question.
Yeah, great question. And that's actually been a big focus of kind of our goals and work for this past year. We had several SMART goals actually kind of around this topic. And it was a challenge to figure out, we know there are other groups out there at UCSF. How do we find them? How do we connect with them? How do we collaborate with them? And it really was kind of just like a go on the UCSF website, find out what groups are out there, find a contact name and reach out to that person, see if they're open to a meeting. I don't like to use the word weasel, but we kind of weaseled our way into a lot of things that way by just being like, hey, Office of Diversity and Outreach, hey, did you know that our group exists? We'd love to connect with you. And kind of, started just by, face to face over Zoom meeting and just kind of sharing the work that our committee does, asking questions about, the work that other groups do. And then just really kind of trying to sit down and figure out, like, how do we collaborate? Like, where are areas where we should be working together or where we could be working together? And we kind of came into it knowing some things that we were hoping to get out of it, which is, an awareness of what those other groups are doing in areas where that might overlap with work we're doing, as well as wanting to like promote our events, like our speaker series. We want to open that to all of UCSF, not just our division. So how can we help promote other, other committees and groups events, and how can they promote ours, and kind of figuring those communication channels out and just really establishing, figuring out what those groups do and what we do. And then, kind of just making sure we're all aware of the work we're doing. So we've attended a number of different, we attended our LGBTQ committees meeting a month or two ago and kind of talked about some of the work they were doing that actually had an overlap with Apex, with like the lived name policy. And so they had a lot of questions about, how is that being implemented both for patients and for staff? Because staff have to like log into Epic with a login that has a name that matches their, legal name, and that may not be their lived name. So just, like I said, kind of establishing those relationships and just seeing what comes of it. We don't always know going into it what we're going to get out of it, but just kind of being open to it, and also just, wanting to know what other groups are out there. Kind of then you have this awareness, and something might come up later. We're like, oh, that'd be a great collaboration point with the, APASA committee or something like that. It is very much a work in progress. Like I mentioned, this has been a big focus of our work over the past year. So kind of you're part of the question, what are those bigger things we could work on? I think that's still something we're like trying to figure out and, open to learning as we go. Did you have another part of your question? Yeah.
I was also curious about like the speaker series, and is there like one person who coordinates? Do you guys all collaborate in identifying who the best would be? Are they from internal or external? And do you give them a stipend? And if so, where's the funding from?
All great questions. So I remember part of your first question too was, is it one person who's responsible for reaching out to kind of other groups and stuff? And this past year it was Christina and myself as the chairs, and realized like, wow, this is a big work effort on top of everything else. So we actually, that's the new outreach committee we created for next year. So that, those two people and the people working on the committee will kind of be spearheading that efforts. For speaker series, we also have had a subcommittee for that, which we kind of combined with our heart to heart group. sort of similar skill sets in terms of organizing events and facilitating dialogue. So there's, two subcommittee chairs who kind of are the lead for that effort, but then there's subcommittee members as well who help with various parts of that. In terms of recruiting speakers, it's been both like, knowledge of people who are at UCSF who we know are doing amazing work that we want to bring in and to talk about their work. And also folks in ARC who have, connections or know of people outside of UCSF who've just said like, hey, I know these two great law professors. They've done a lot of work on race and reform in the criminal justice system. So we brought them in and had an amazing speaking event. And then you asked about stipend. We do have we were able to get a small stipend. I think it's like $5,000 for the whole year, something like that, that we can use for speaker fees. So I think, yeah, we reach out and some people within UCSF are like, no, I don't need the stipend. I'll just do this because I'm interested in doing it. But we do try to offer that because we want to be respectful of people's time and appreciate the work they're doing. Did I get all the parts of your question? Sorry, part I missed. Oh, where does the money come from? That's a good question, actually. I don't know the answer to that one. The department's budget, yeah. Yeah, thanks.
Question from Zoom. How impactful, this is from Robert Rainey. How impactful has this all been since COVID and the wake of George Floyd murder?
Yeah, great question. So our committee actually really got started around the time of George Floyd's murder, which I think, a lot of organizations around the country, that was a big spark for people to start doing this long overdue work. So, we don't really have much to gauge from before that. That was, a few months after George Floyd's murder was when we really kicked off like our charter and our climate survey. So we can't really compare it to what it was like before, but we have in our climate survey now that we're in our third year of it, we are actually starting, be able to see some trends and changes over time. So hopefully we'll be able to see more for the next couple of years as well.
Thank you. My question is about how have you dealt with this phenomenon called white fragility? And in the work that you do, with the committees that you work with, maybe even with the doctors and so on. And because that is a very, I think some people would call it a subtle phenomenon, but for us BIPOC, it's not subtle. It's right here on our faces. And unfortunately, so we do all this beautiful work, you do all this beautiful work, of these committees and the meetings and speakers and so on. But this subtlety that again, for us is not subtle. And it's unfortunately weaponized against us, against BIPOC. And it might not even be about something about a racism topic, but sometimes it's about work. It's I'm asking something, well, you are BIPOC, and then, but I'm very sensitive. You should not ask me that. You should not be asking me that type of stuff, or don't ask me to do more work because, so, this type of things, again, it's white fragility. And the way I see it is pervasive. And also the way I see it, it has a potential to collapse all the work on the DEIBJA, AR, and so on that a lot of us are doing. So how have you dealt with that? Have you thought about that? What are your experiences on that?
Yeah, do you want to speak something?
It's a really good question and a heavy question, but I think our first year, and keep me honest here, but our first year was really based on education and educating ourselves. And so like you see that we have these SMART goals, and as these continue to grow and build upon each year after year, but our first year was primarily around how do we really push educating everyone more on this topic so that we can address some of this, I think the phenomenon you described as white fragility. But it's, the more that we have these events and the more participation, more facilitated discussions that we're having, it's helping spread and educate people more, and in the hopes that we can help minimize that a bit, right? But it exists. I don't know, Carrie, if you have any thoughts, or Christina, but educating everyone involved. And, within our IT department is a big goal of ours as well, and continues to be, but it was one of our original goals, is just to make sure the more that we educate, the more that people understand having these discussions amongst each other, and the more people grow, we can help minimize that a bit.
Yeah, I mean, I think Sana summed it up really well. Education and training was a big piece, and I think it's a part that we are, now that we're a couple of years out from that first year goal, we had a couple of standards. We had everyone complete a foundations of DEI training, and then folks in, at a certain leadership level and above to do DEI Champion training. Obviously, training is one piece and it happens one time, and we want it to be ongoing. So I think that's something we'll continue to circle back on and want to keep reinforcing. There also may be people who weren't working in our department 3 years ago and didn't go through that training. And I think also just the question of white fragility is we don't have a full answer to it. And it's going to be something we have to continue to be aware of and continuing to address and think about. I think one thing I've appreciated about folks in leadership roles, particularly our executive sponsor, is their willingness to stand up and be vulnerable and say, like, this is something I'm learning about, like, this was my experience, I have to learn about this, and trying to just set examples. I know I, as a white person, try to set the example of being willing to be open and vulnerable. I may not be able to convince everyone else to do the same, but I can at least show up and try and publicly show, like, here's an example of how to confront that and be open to change. But really a big question. Yeah.
I was just going to add just a few things too. In terms of just having ongoing education and allowing resources, I think one of the spaces that we have is our heart-to-heart subcommittee, and it's actually a space where folks come, and depending on the topic or the conversation that we're talking about that day, it's a place for people to ask questions and really kind of play through different scenarios of experiences that they might have and take away how additional people how that could be perceived, but also to just my first initial thought is just having the resources, because in different forums that we're bringing this information, not all people will obtain the information, but also having the ability to find that information and look it up on their own. Some of the conversations we've had is delving in difficult conversations with family members. And so that was a big turnout, especially around the holiday season. People really wanted to know, like, how do we interact with such a huge topic in this climate? So I hope that answered.
Just one more thing to add. I think, they talked about this in the equity and health panel earlier, but it is a really difficult topic. And so, as we're working really hard to try to, it's a really, no matter, it's a very challenging topic. And I think that as long as the people participating, the team members, IT team members, even the general, anyone in the organization that's interested continues and is open to growing and learning, I think we're making progress. I look at a lot of the data, and so I remember the focus group data and reviewing it, and that was 2 years ago when we first did it, and a lot has changed since then. So we see the progress is there. It's just we have a long way to go, and it's always going to be a challenging topic. We just have to be open to grow and want to learn. And as long as we have that, I think it will be okay. So.
And I have a follow-up from Robert Rainey. Again, he says, I actually joined our Berkeley IT action team because of the situation and wanted to continue to make an impact. Do you have any other ideas that would help other than Brave Space? And do you have to mention these things within your regular meetings?
Sorry, could you?
Do you have any other ideas that would help other than the Brave Space? And it says, do you have to mention these things within your regular meetings?
That's a good question. I think one of the things that we have talked about recently, as well as we've gotten really good engagement in, ARC events and people showing up to heart-to-heart discussions, speaker series events, but how do we reach those people who aren't electing to come? And one of the things we're wanting to explore for this coming year and kind of handing this as a goal off to, next year's cabinet positions is to, have people, outreach to specific teams, go to, application team meetings and do a 5-minute presentation on why pronouns are important, or, how racism manifests in the EHR. So really kind of making it a goal of like taking it to the people rather than just expecting or hoping that they'll come to us. So I think we haven't done it yet. I hope it goes well. So I can't weigh in on whether it will work or not. But that's one idea that we're hoping to explore over the next year is, yeah, getting it in front of people and forcing them to look at it.
Thank you.
Yeah.
Can you share some examples of topics or themes that come up in your heart to hearts and you guys decide them as a committee, correct?
Yeah, the subcommittee meets a couple times throughout the month to kind of review topic options, pick one, and then whoever the facilitators are for that kind of go over what they're planning to present and get feedback and such. Some of the ones I mentioned in the presentation, we did one on intersectionality and LGBTQ plus visibility in the lead up to Pride Month. We've done like a Black History Month and unsung heroes. So like unsung Black heroes in healthcare who maybe didn't get attention because they weren't white people. Other things Christina mentioned, we did a difficult conversations, both a family edition and a colleagues edition. So how do you have difficult conversations with your belligerent uncle at Thanksgiving, and how do you have conversations with, the people you work with as well, and how those dynamics can be different. Other topics, what other ones we've done? Critical race theory. Yeah, we did one on critical race theory. That was very interesting. Health disparities impacting women of color. I think that one talked a lot about like maternal fetal medicine and just the very, very sad statistics that, Black women in particular, having much worse health outcomes, especially around maternity and such. Yeah, we've got a whole list of other topics that are just not coming to me now, but yeah, sometimes we try and do them. We've also done some kind of later ones, like cultural celebrations, or like a sort of like a show and tell, where people came and shared information about their cultural background, or like holidays, that their family observes that, people might not have known about before. So we try and do like a mix of, like really meaty sort of academic, like critical race theory, really like getting into the weeds on a topic, and then also like lighter, happy things, because the work is heavy and the work is hard, and it's nice to sometimes take a break and like celebrate the happy things that, come out of our diversity as well.
Thank you. No more questions from Zoom? Oh, no worries.
I have that uncle, by the way. I just want to follow up on something about where we're talking about, forceful inclusion in these meetings and sessions and demonstrations versus people volunteering and, going to those meetings on their own. Because as a, person who feels like, before I was at UCSF but even while being at UCSF, feeling like you're very inclusive and you understand these things, and then going to like a speaker series talk and being just absolutely blown away. I think it's really important to expose people to things when they think that, they may just be ignorant to not knowing that they aren't being as inclusive as they should be, or they don't understand things. And it even happened in this meeting with her question, right? Really impacted me. So I think forceful inclusion is something we should do.
Appreciate that.
Andrew, just to add to that, the nice thing about that idea is that we have, Carrie mentioned earlier, there's protected time tracking, and there's support from executive leadership to participate. So we can always consider, you can't forcefully include anyone, but there's motivation. There's executive support to encouraging people to participate. And then the other piece of this, along with that support, is that we have we're a standing agenda item now on every all hands, both the broader IT as well as the health IT, and that speaks volumes to the support that we do get to try to encourage participation.